Good morning. This is Brad Anderson, State Director for AARP in Iowa. Thank you for joining today and participating in our Teletown Hall about Medicare changes for 2019, including, of course, the new Medicare cards. This is one of our most popular calls, so thank you for being on. Today's conversation will address questions and issues specific to those who are either enrolled in Medicare or know someone who is, which should be just about everyone on the call here today. So we are joined, and we're very pleased to be joined by experts from the Iowa Insurance Division's Senior Health Insurance Information Program, well known as SHIIP, and Senior Medicare Patrol in Des Moines, Chris Grosse and Patty Price. So thank you all for being here today. We'll be turning it over to both of them shortly to provide an overview of important Medicare benefits and changes for 2019. And then Chris and Patty will be taking your comments and answering your questions. So as we proceed, if you would like to ask a question, and this is very important, please press *3 on your telephone keypad to be connected with a screener who will note your name in the question. So again, if you want to ask a question, press *3 and you'll get connected to our screener. And the sooner you press *3, the sooner you will be online with our guests. We have hundreds and hundreds of members joining us on our telephone town hall this morning from all across Iowa. So again, thank you for being on the call today, both on the phone and online on Facebook Live. So we're streaming it live on Facebook. So in order to get as many questions as possible in the hour, we ask you to please be as concise as possible with your questions for our guests. So you may also want to have a pen and notepad handy as you jot down phone numbers and other information that we will be sharing throughout the call. Again, this is ARP Iowa State Director Brad Anderson, along with Iowa SHIIP experts Chris Grosse and Patty Price. They will be joining you for some important information and taking your questions on Medicare changes in 2019. So press *3 now if you want to ask a question, and you will be connected to a screener to get your information, and then you'll be put in the queue. So let's go ahead and get started. It is a real honor for me to welcome our guest, Chris Grosse, Director of the Iowa Senior Health Insurance Information Program, better known as SHIIP, based in the Iowa Insurance Division in Des Moines. We are delighted she is with us to share the latest on Medicare today. Chris, to start off the conversation with our members, could you tell us a little bit about SHIIP for those who are less familiar with the program and how it works?
Sure, Brad. Thank you. SHIIP is a service of the State of Iowa Insurance Division, and we do receive federal funding from the Department of Health and Human Services, but there is a SHIIP in every state. So if you're from Iowa, you're seeing the SHIIP program here, but it is available in every state and territory, so you can refer family members to the SHIIPs there. We help people with questions and problems related to Medicare and health insurance. And now we also handle Medicare fraud issues, so you can call us for that, and we'll be talking about that a little bit more in a few minutes. Our services are free, they're objective, and they're confidential. We don't sell insurance, we don't promote or recommend anything. We're here as an objective source for you. We work through local community organizations that are our sponsors in the different counties. We have over 140 sponsor sites in the state, and we have over 360 volunteer counselors who are out there ready to help you in your community. And particularly this year, we want to talk with you about making sure that you're getting your Medicare Part D drug plan or Medicare Advantage review done during the open enrollment, which runs till December 7th.
All right. Well, that was a great overview. Thank you, Chris. And now I want to turn the conversation over to Patty. Can you tell us about some of the changes to Medicare and what is new in 2019?
Sure. I think one of the biggest things that's new in 2019 is that all Iowans on Medicare received a brand new Medicare card. The biggest reason that you received the new card is to protect yourself against fraud. Medicare removed the Social Security number from your card, and they've now assigned you with your own new unique identification number. If you did not receive your card in the mail, you can call 1-800-MEDICARE. If you need to change your address, you can call your local Social Security office to make that change. We really want to stress to be aware of scammers who might call you and ask for your Medicare number, Social Security number. Medicare will never call you to ask for your number. They already have it. protect yourself against fraud and hang up when someone calls and asks for your Medicare number or your personal information. Your Iowa SHIIP is now your SMP, or your Senior Medicare Patrol. Any concerns about Medicare fraud can be reported to your local SHIIP SMP or by calling our state SHIIP SMP office at 1-800-351-4664.
Excellent. Well, thank you for that. And I do want to remind all of our listeners on the phone, this is, again, Brad Anderson from AARP Iowa. Please press *3 on your telephone keypad if you do have a question for us. Again, we ask that you do keep your questions concise because we want to get through as many of them as possible. But if you do have a question, press *3 on your keypad. And we have one here from Carol in Ames, who is concerned about her premiums doubling. So, Carol, what is your question?
Well, my question was that my husband's and my premiums for Blue Cross Blue Shield doubled after moving to Iowa because we both have atrial fibrillation, and it was a pre-existing condition. I have talked with the SHIIP people. I really appreciate them. We decided we needed to stay, even though our premiums were doubled. But I was just wondering, is there anything in the future in Iowa that you think this might be changed?
Well, Carol, premiums for Medicare supplements are set by a group. They're not for an individual person. And so when you moved from another state to Iowa, the change in premiums was probably due to different health care costs between the two states, wouldn't you say, Patty?
Yes.
And so that happens. You can stay with your plan, but the premiums might change based on your address and the cost of health care in the new state. So we do have a Medicare supplement guide for Iowans that shows the premiums for the Medicare supplements offered in Iowa. It gives you some idea of how to compare plans. So anyone who's getting a rate increase, I think that would be a good resource, don't you, Patty?
Yeah, great way to look at that and compare and see if you want to make a change.
Thank you. Thank you both for that question or an answer. And thank you for the question. So again, this is a reminder. If you do have a question, please press *3. And we're going to get through as many of these questions as possible. Be concise with your question, and we will get you an answer. So let's go to another question here. We've got Thomas from Newton, who is concerned about expensive prescription drugs in 2018 and worried about the donut hole. Thomas, what's your question? Thomas, are you with us?
Yes.
Yeah, so you're on the call, and feel free to ask your question.
All right. I'm taking a tremendously expensive drug right now, and before signing up for my 2019 Part D, if somewhere in the course of 2019, if I am prescribed to stop taking that drug, is that going to affect my premium or deductible in any way in 2019?
Thomas, that's a great question. Your deductible is set by the plan, and just because you change a drug or drop a drug or the doctor prescribes a new drug, if you've already met the deductible, you've met the deductible. It depends on when you fill the prescriptions and in what order you fill them, but it's not going to make you start all over with that deductible. It's not going to change the premium on your plan. Whatever premium you're looking at right now for the 2019 plans, those have been set and approved by the federal government, and they can't change the premium on you in the middle of the year.
I think one other thing, too, just to keep in mind, if you change drugs, you want to check with your plan to make sure it's on the formulary. If it's not on the formulary, they're not going to cover it. You might have to do an exceptions request, which they may not approve. So it is really important to make sure the drug is going to be on the formulary of the new plan.
Thomas, does that answer your question? Okay, excellent. Let's get to one more. We have another question about the donut hole. This one is from Wesley from Mount Pleasant. So Wesley, what's your question?
My question is, I was paying like $400 for Spirea. So Medicare finally approved it, and I come down to 120. Then, so 1 month I'm paying 120, 125, something like that. And then the next month I'm 140 something. I back up again. They say I'm in a donut hole.
Okay, that is something I was just going to start talking about. Once you do reach a certain dollar amount in the year, the total cost of your drug, you do hit what we call the donut hole. But the good news that I want to share with you is that the donut hole is changing, and it's going to be closing. And matter of fact, in 2019, for brand name drugs, there will no longer be what they consider to be a donut hole, and the maximum you'll have to pay in the donut hole for brand is 25%. So people can experience changes in the cost of what they pay when you hit the donut hole.
Thank you.
Great. Thank you. Okay, this is a reminder to anyone on the call, press *3 if you have a question. And Patty and Chris are here from SHIIP to answer that question, so we appreciate their help with that. We're going to have a couple of poll questions throughout the call, and so I do want to get to our first poll question here. And again, you just answer the poll question by using your telephone keypad, and this helps us get information from you, and also gives us kind of more information of what's going on the ground and some concerns out there. So our first poll question is, how many of you have ever been called by someone claiming to be Medicare or asking for your Medicare number? Press 1 on your keypad if this has happened to you. So again, let me read this poll question, and this is related to something we discussed earlier, fraud, but we want to hear from you if this has ever happened to you. So how many of you have ever been called by someone claiming to be Medicare or asking for your Medicare number? Press 1 on your keypad if this has ever happened to you. So, Patty, I want to turn it over to you, and we can then talk about some of these concerns and questions that folks are having.
Okay. As I was sharing with one of the callers here just a few minutes ago, one of the biggest changes that's happening with Medicare Part D in 2019 is that there is going to be changes to that coverage gap or donut hole. And back when Part D started, all Medicare beneficiaries were responsible for 100% of the cost of their drugs when they hit the donut hole. And in 2019, the Affordable Care Act and the Balanced Budget Act of 2018 made the decision to close that donut hole a little bit earlier. And so for brand name drugs next year, the maximum you'll pay when the total drug costs that you've spent reach $3,820 in 2019, the maximum you'll spend for brand drugs in the donut hole is 25%. The maximum you're going to spend on generic drugs will be 37%. And then in 2020, the donut hole will close for generic drugs also. Every year you have the opportunity to change your plans, and I think Chris talked about this a little bit ago. October 15th to December 7th, and when some of you are concerned about maybe a drug that's gone up in cost or a drug that's not being covered anymore, you think your premium, you got your information and your premiums on your Part D plan are going to be a lot higher, it really is important for you to have a review done on that and have us take a look at those plans and see, could you save a lot of money if you change plans? Would they cover your drugs in a better way? And matter of fact, last year, our organization SHIIP, we saved Iowans on Medicare over $21 million by helping compare plans. We can help you with your Part D plan choices and your Medicare Advantage plans also. And so you can call SHIIP at 1-800-351-4664. Also, after the first of the year, there's going to be a new Medicare enrollment option, which will be available between January 1 and March 31st. Anyone who is enrolled in a Medicare Advantage plan on January 1 of 2019 will still have a window of opportunity until March 31 to either change to a different Medicare Advantage plan or to change back to original Medicare. And if you're struggling with your prescription drug costs, we just want to make sure that you're aware that there are some programs and assistance that might